Suicide is the act of intentionally taking one's own life, and suicide can happen when a person feels more pain than they feel they can cope with. The person often does not want to die, they just want to end the pain that they are suffering. In the UK, every 90 minutes somebody takes their own life. That's roughly 6,000 suicides per year, with about 140,000 attempts. And these figures have hardly changed for more than 20 years, which shows how difficult and complex a problem suicide is to understand and prevent. Nevertheless, our research group at the University of Manchester believes suicide is not inevitable and it can be prevented through psychological approaches. For the past 10 years, we've been conducting research to improve our understanding of the psychological mechanisms that contribute to why a person may think about suicide as the only solution to their problems. Our theory suggests that people are at greater risk of suicide if they are struggling to cope with problems they perceive to be overwhelming, impossible to escape from, and if they feel there is no chance of getting help from anyone. We have developed a new psychological intervention, a talking treatment, that prioritises the targeting of suicidal thoughts rather than treating such thoughts as a symptom of a diagnosable mental illness. Our new talking therapy aims to support the individual to nurture a new awareness of their difficult problems. It encourages them to develop a more realistic and helpful approach to their thinking, to take on board all the facts about their situation, and to develop a stronger awareness of their personal strengths, as well as the things that they already know they can struggle with at times. So far, we have evaluated our new talking treatment with people at risk of suicide who also hold unusual beliefs or hear voices others cannot hear. We've also completed a trial with suicidal prisoners, which resulted in the number of suicidal behaviours amongst the group that received the therapy being halved. And we've also completed our third trial of the therapy, this time with people in mental health inpatient wards in Manchester. And we're currently conducting our first large-scale multi-site trial of the psychological therapy with people with psychosis living at home. My name is Daniel Pratt. I'm a clinical psychologist working in the School of Health Sciences at the University of Manchester.